Hello and welcome to the Skin of Color Savvy, the art and science of treating patients with skin of color. This is the official podcast of the Skin of Color Society, and it's produced by HCP Live. Hosted by the Skin of Color Society leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally competent care practices, and other news important to skin of color dermatology. It features experts in the field. Whether it's groundbreaking research, practice-changing insights, or highlights from our vibrant global community, we're here to provide dermatologists and care providers with expert perspectives on treating patients with skin of color. Let's dive in and explore how we can continue to advance care, celebrate diversity, and make a meaningful impact together. First, I should say I'm Dr. Bob Brodell, professor and chair of the Department of Pathology at the University of Mississippi Medical Center. I'm the past founding chair of the Department of Dermatology at the University of Mississippi. In today's episode, I'll be sharing news and information about a variety of initiatives offered by the Skin of Color Society, and talk a little bit about my own institution, the University of Mississippi. About the Skin of Color Society. I'd like you to know a little bit about the Skin of Color Society for those of you who may not be familiar. It's an international professional society founded in 2004 by globally recognized leaders, including Susan C. Taylor, MD, who, by the way, will be installed as the next president of the American Academy of Dermatology at their annual meeting in March 2025. Dr. Taylor began this fantastic organization with a group of founding members who are also leading experts in the field of dermatology. The Skin of Color Society stands tall as the world's leading organization dedicated to promoting awareness of and excellence in skin of color dermatology. We have members in over 30 countries around the globe. The Skin of Color Society is committed to the education of healthcare providers and the general public in issues that relate to dermatologic health in skin of color. The mission of the society is to promote awareness of and excellence within skin of color dermatology through our 4 pillars: research, education, mentorship, and advocacy. We're committed to increasing diversity, inclusion in the field of dermatology to advance patient care. Through this podcast and other initiatives, we want to reach our colleagues in the greater house of medicine to strengthen the dialogue and exchange ideas about the nuances in treating patients with skin of color. I became a member of the Skin of Color Society for several reasons. First, I work in the state of Mississippi that has a population that's 38% African American. Secondly, I ran a department of dermatology that graduated 2 African American residents out of 20, 10%. Actually pretty far from representing the 38% African Americans in our population, but it's a start. I wanted to interact with individuals who could help me design a pathway program and work to mentor African American medical students, as well as provide opportunities for away rotations in Mississippi and I wanted the chance to interact with people who could come to see that Mississippi is not what they thought. Perhaps even working with members of the Skin of Color Society and reaching out to medical students would allow us to attract more medical students who might have an interest in doing a dermatology residency in Mississippi. Switching gears, I'd like to talk about the dire need for more research into various dermatologic conditions that affect patients with skin of color. The Skin of Color Society has been working very hard to fill the knowledge gaps that are so obvious in our field. There are a number of conditions like hidradenitis suppurativa, keloid scars, central centrifugal cicatricial alopecia that predominantly affect African Americans. Yet until the past 10 years, these areas received only scant attention by researchers. That's changing in no small part due to the efforts of leaders of the society. We've been working for many years to support research and innovation through diverse programs and awards, many of which are presented in collaboration with a variety of institutions, organizations, and corporations. The Skin of Color Society offers several of these, including the Sanofi and Regeneron Diversity, Equity, Inclusion Mid-Career Award, which is administered in collaboration with the Dermatology Foundation. The Dermatology Research Awards focus on inflammatory dermatologic diseases in skin of color. The second is a Career Development Award, which focuses on inflammatory dermatologic diseases in skin of color, where further clinical, translational, and basic science research is needed. The next is the Institutional Research Fellowship Grant, which provides opportunities for underrepresented minority physicians to conduct research on skin of color dermatologic conditions and train for and assume leadership roles in clinical dermatologic care that also focuses on public policy, health services research, and biomedical research. Finally, there's a very exciting Early Career Innovations Award, which is akin to a Shark Tank meeting in dermatology. This award is for young visionaries and innovators who have creative solutions addressing needs and opportunities within the skin of color dermatology ecosystem. What's fascinating for those of us in the field is to take in all of the insights and latest findings at the annual Skin of Color Scientific Symposium, where emerging researchers from around the world share their work through oral poster presentations, poster abstracts, and invited speakers that present their research. Recipients share these seminal contributions to the specialty through their cutting-edge research. You can learn more about skin of color research programs by visiting the website, and I encourage you to check the Scientific Symposium program that'll be offered on March 6th, 25 in Orlando, Florida, just before the annual meeting of the American Academy of Dermatology. I'd like to talk to you a bit about the common perennial skin condition known as winter skin. Obviously, most of our listeners know all about winter skin and how to manage it. But you may not yet know about the initiative known as My Best Winter Skin, which is a campaign created in 2023 by the Skin of Color Society and its foundation. This includes an International Awareness Day, My Best Winter Skin Day, which is observed on October 24th. My Best Winter Skin Day marks the beginning of a season of giving, education, and volunteerism by members of the Skin of Color Society. Already this fall and in the coming winter months, at numerous events around the U.S. and Canada, members and advocates will distribute dermatology-developed education materials, donated product samples by our sponsor, Clinique, and hope to raise awareness about optimal winter skin care. It also will hopefully generate some donations to the Skin of Color Foundation. Donations will help innovative research, education, advocacy, and mentorship in skin of color dermatology. You can view our 7 winter skin tips and find out how to get involved in this campaign in your own community by visiting the Skin of Color Society website and click on My Best Winter Skin. We'd love to help support you and your efforts as you reach out to areas in your own community as you try to educate the public. Please get in touch with us if this interests you. Let me talk about a fourth area that is very important to me in Mississippi. We developed a program called TORPEDO, Training Opportunities in Residency Programs to Enhance Diversity and Outcomes, TORPEDO. When the program first started, we decided to approach this area in every way that we knew how to do that. It involved, number one, annual visits that I made to HBCUs with medical schools, including Howard University, Meharry School of Medicine, and Morehouse School of Medicine. In these visits, I wanted to just begin a dialogue where there had been none before. When I switched to the Department of Pathology as chair, Jeremy Jackson, chairman of the Department of Dermatology at this time, continued to make these visits to these historically Black colleges and universities with medical schools. Number two, we realized early on that there was a problem with mentoring in 2 of our universities, at Morehouse and at Meharry. They didn't have departments of dermatology there like the well-developed dermatology department at Howard, and that made it difficult for young medical schools to achieve the mentoring they needed. Through my outreach, we opened doors to allow medical students to reach us and learn about things they need to be doing early in medical school to make themselves strong candidates for our field. The third thing we did was recruit medical students at these historically Black colleges and universities with medical schools to do away rotations at the University of Mississippi. We were able to fund 6 of these slots for people to come to Mississippi and spend a month with us and not have to spend double rent, both at their home institution city and during their away rotation. Finally, we've supported a number of research projects at the University of Mississippi that medical students at these institutions really had no way to latch onto. That's a wrap for today. Hope you've enjoyed our discussions about the Skin of Color Society and its many programs. Thanks for joining us. This is the first episode, actually, of Skin of Color Savvy. There will be more episodes following this. I hope you find them to be informative and inspiring. If you want to contact me about anything that I've said today, something you may have an interest in, my email is rbrodell@umc.edu. Or you can text me on my cell phone, 330-883-5302. Don't forget to subscribe to the HCP Lives newsletters and follow us on social media to stay up to date on the latest dermatology and more that relates to skin of color. It's been great to meet everybody.